Warning for healthcare practice owners. If you're paying for SEO right now, there's a real chance it's making you less visible to the patients you actually want, not more. I'm Ezra Stine. I run Stine Marketing and I work with healthcare practices across the New York metro area, chiropractors, dentists, physical therapists. A lot has changed in local search over the last few years. One thing hasn't. When someone who doesn't know your practice yet needs a provider, they open Google. Referrals and paid ads matter too, but Google is the one channel that never stops running, whether you're paying attention to it or not. So let me ask you something. Have you paid an agency month after month, watched the traffic numbers climb in the report, and still not been able to name one new patient that came from it? Or have you looked your own practice up on Google Maps and found a practice 3 blocks away sitting above you, one you know for a fact isn't better than yours? And has that started to make you wonder whether any of this actually works? So why is this happening? Because Google fundamentally changed how it understands local businesses, and most agencies never adjusted. Google doesn't just match keywords on a page anymore. It identifies entities, real organizations in real places providing real services, and it ranks based on how confident it is about who you actually are. If Google isn't certain what your practice is, where it operates, and what it treats, every dollar you spend downstream of that gets wasted. Meanwhile, here's what most agencies are still selling you. They build backlinks in bulk from whatever is cheapest, sites with nothing to do with healthcare and nothing to do with your city, and Google stopped counting those as trust a long time ago. In some cases, it counts them against you. Then they publish blog post after blog post about symptoms and conditions, and that quietly teaches Google that your website is a health blog rather than a practice that treats patients. So Google sends you people researching their back pain at midnight instead of people ready to book an appointment. Your traffic goes up, your schedule doesn't. And there's something happening right now that makes this urgent in a way it simply wasn't 2 years ago. Patients aren't only searching anymore, they're asking. They open ChatGPT, they hit Google and get an AI summary sitting above every result on the page, and they type something like, "Who's the best chiropractor near me?" and the AI hands them a short list, 2 names, maybe 3. Here's what most practice owners haven't caught up to yet. Those systems don't pick at random. They don't pick whoever published the most blog posts. They recommend entities they can identify and verify, practices where the information about them lines up consistently everywhere the AI looks. Which means the exact same foundation that gets you into the map pack is what decides whether an AI says your name at all. If Google isn't confident about who your practice is, ChatGPT certainly isn't. And unlike search results, there's no page 2. You're either in the answer or you don't exist. So every practice I work with gets a monthly report showing whether AI systems are actually recommending them and where they stand against the practices that are. Almost nobody in this industry is tracking that yet. Most agencies don't even know it's happening. Meanwhile, there are only 3 spots in the map pack, and more practices in your area are figuring this out every year. Ask any practice owner what they want out of marketing, and you get the same 3 answers. Show up in Google Maps, show up in organic search, and turn that into calls that become appointments. Everything I do is built to produce results in those 3 areas in that order. Here's what that looks like when the sequence is right. A chiropractic practice in Midtown Manhattan came to me with over 400 Google reviews and 50,000 YouTube subscribers, and they were nearly invisible in the map pack. All that real-world authority, and Google wasn't recognizing any of it. We established the entity first, then fixed the site structure, then built authority that was actually relevant to healthcare. Map pack visibility went up 847%, organic traffic up 312%, patient inquiries up 203%. Results started in month 4, and I tell every practice that timeline before they sign, not after. Every practice I work with gets the same thing, a full entity and visibility audit, the foundation that determines whether Google and AI systems can recognize you at all. Google Business Profile optimization, citation and authority building that's actually relevant to healthcare, a monthly ranking report showing exactly what moved, a monthly AI visibility report showing whether you're being recommended and who's being recommended instead, and a short call every month so you always know what's happening and what's next. No contracts, month to month, and you work with me directly, not an account manager, not a junior hire, me every time. And none of this is guesswork. Every project starts with a full competitive analysis, so I know exactly what it's going to take to outrank the specific practices you're up against, not a generic package, a plan built specifically around your competition. That's real confidence in the plan itself. I still won't promise you a ranking. Nobody honest can make you that promise. But I can promise you the plan is sound. And there's a specific order to how that plan gets built. Branded assets come first before a single link or press release goes out. Only once that foundation exists do we build the links and the press coverage on top of it, and those links are topically relevant, safe, and built to work across organic search, Google Maps, and AI search, not whatever's cheap and available that month. Month 1 starts with a set of branded entity assets. A Signal 10 signal package, a branded Web 2.0 network, a batch geomap documenting your actual service area, a press advantage release establishing third-party press coverage, and a set of cloud pages. Every one of those gets linked back together and consolidated into a single ID page. That ID page is what gets referenced directly in your website schema. The @ID Google reads when it decides who you actually are. That's month 1, before we've touched a single ranking. And none of this is a black box. Every client gets logged into a live dashboard. You can check your organic rankings yourself, your Google Business Profile position, your citation progress, your AI visibility report, whenever you want, not just when I send the monthly summary. You even get access to the underlying project workbook, the trigger words we're targeting, the competitive analysis, the Tier 1 and Tier 2 link building, all of it. I'm not asking you to trust a PDF I made. I'm handing you the actual data. Okay, so here's my pitch. Give me 30 minutes and one look at your practice, and I'll show you exactly why you're not ranking where you should be. On that call, I'll pull your practice up live, your map pack position, your closest competitor's position, and the specific gaps between the two of you, and I'll tell you what it would actually take to close them. If you don't think that plan is realistic and achievable, we don't go any further. No follow-up, no chasing you. You've got nothing to lose here. At the very least, you walk away knowing exactly what it takes to outrank the practice down the street. Take a look at the case study below or the case study page, then pick a time on the calendar. I'm Ezra Stine at Stine Marketing. Talk to you soon.